we're talking indications for MRI, especially surveillance or screening, part 2. And we've already hammered home the different tiers that patients exist in based on their PSA, their Gleason score, and their clinical T category. And we said that PSAs of 10 or less, Gleason scores of 6 or less, and T categories of T1C or T2A are great candidates for surveillance. This would be tier 1. So this would be something like 10 nanograms per deciliter. So there are other criteria that are out there, and in one of the vignettes we talked about inclusion criteria. I want to give you a specialized criteria developed by Epstein, the so-called Epstein inclusion criteria, and in this scenario, similar to tier 1, the Gleason score must be less than or equal to 6. I'll put the name up here just to give the author credit. 2 or few cores of cancer. So you've got 12 cores, so 2 or less of those cores have cancer in them. So that's something a little different than what you've heard before. So we'll say 2 cores or less. And then finally, the third criteria is less than 50%, or 50% or less of each core is involved by tumor. So in other words, let's say this is a core, and less than half of that core is involved by tumor, area-wise or volumetrically. Those 3 criteria, this one, and this one, place the patient in the Epstein category of a surveillance candidate. Do notice that this patient has already had at least a single biopsy, otherwise you wouldn't have cores to make this designation and this Gleason designation. So this is after a single biopsy has been performed. Now the patient goes into MR surveillance.